One morning, Dr. McConaghie asked me to see a patient who had had a persistent cough for some time. It started with a flu-like illness, but soon progressed to fever and chills. Jim knew that I had worked as a respiratory registrar with Malcolm Sear in New Zealand and wanted an opinion, as his x-ray showed a small basal pneumonia. The patient was a singer by profession who performed in the local hotels and had been off work for nearly 3 weeks. He gave a history of severe headaches, lethargy and joint pain, and I noticed he had a small rash. He'd already had numerous courses of antibiotics, which had done little to alleviate his symptoms. Of more concern was the fact that on abdominal examination, he also had a large spleen. Dr. McConaghie was a seasoned middle-aged physician who had worked out towards the bush in the isolated towns of Dalby and Goodawindi. I respected colleagues who based in these environments, as they worked in the absence of radiology and laboratory backup, diagnosing ruptured ovarian cysts and appendixes, possibly delivering babies late at night, and allowing God to take away the aged by dawn. His Q fever test is negative, he said, holding the results in his hand. Q fever is a disease that was first described by an Australian pathologist called Edward Holbrook Derrick, after an outbreak of the illness in abattoir workers in Brisbane. It is caused by an unusual bacterium called Coxsackie burnetii, which is found in ticks, cattle, goat, sheep, and other domestic animals. It causes severe headache, respiratory distress, and joint pain. I think I know what it is, I said. Do you keep budgies? I do, he said. Why? Because you need to give them the antibiotics as well as yourself. I think they're infected with chlamydia. Dr. McConaghie looked at me with profound interest. He knew chlamydia trachomatis was the cause of the well-known sexually transmitted variant, but I was referring instead to its biological relative, chlamydia cysticercosis. How did you work that out, he inquired. I agreed that the patient had the signs of Q fever, but he had an enlarged spleen on the left rather than an enlarged liver on the right. Although it was a rare condition, I had seen some psittacosis cases in respiratory medicine in New Zealand, and once seen, they are never forgotten. This patient presented with a raised pink facial rash called hoarder spots, seen almost exclusively in this condition. The sputum results returned chlamydia psittacosis, and the patient returned to full health with a double dose of doxycycline. When I went to see him perform at the Spotted Cow, an historic hotel on the corner of Ruthven and Campbell Streets, he invited me up to the stage and we shared a microphone for Van Morrison's Brown-Eyed Girl. It was a duet that we went on to perform together on many other occasions during my time in Toowoomba. Within a few days, Dr. McConaghie returned the favour of the difficult diagnosis. The patient was a 33-year-old farmer suffering from similar flu-like symptoms. Some of his joints were quite stiff and swollen, especially in the mornings. It was evident that the illness was more debilitating than life-threatening, but I didn't recognize it. He's even got a little rash, but I don't think it's hoarders, said Jim sarcastically. The patient was unwell and wanted to return to his duties on the farm. I felt it had to be something transmitted from an animal. My sixth sense told me it had to be a local or tropical illness. I get the feeling it is a transmitted infection, I replied. Good guess, he said. We'll hold on to you. It's Ross River virus. Dr. McConaghie explained that this was a debilitating disease transmitted by saltwater Aedes vigilax mosquitoes, endemic to Queensland. The virus was not contagious, but it used kangaroos as reservoir hosts. There was no cure, and the patient often remained debilitated for many months. The Ross River is awfully close to here, he explained. It's up in northern Queensland.